So what's our rationale for early introduction of IBAT inhibitors? Well, let's look at the ileal bile acid transporter inhibition and its role. So we know that the majority of bile acids that are excreted are actually reabsorbed by this very specific protein located in the ileum, and it's called an ileal bile acid transporter. And the majority is actually undergo this intrahepatic recirculation and return via portal circulation to the liver. When we're doing our biliary diversion surgery, we are trying to eliminate this intrahepatic circulation. And recently, a drug was introduced that's a very specific inhibitor of this protein. So it's an IBAT inhibitor. Doing what we've tried to achieve with surgical diversion, or reducing the bile acid load that comes back to the liver through this intrahepatic circulation. And we now have two drugs, adavixabat and maralixibat, that are both approved for use in progressive familial intrahepatic cholestasis. We're starting to get some long-term data from use of IBAT inhibitors. And if you look, for example, at this recent study, we can see that there are patients who are definitely responders to adavixabat, patients who are partial responders, and then patients who are non-responders. And we would like to look at their native liver survival according to response in reduction of serum bile acids. So if we look at the patients who are responders in terms of their serum bile acid reduction and native liver survival, it's 100%. And it's also much higher in partial serum bile acid responders than in those who are non-responders. In fact, all patients who had a pruritus response at month 6 remained transplant-free. So it's very impressive data that kind of goes along with our clinical knowledge that if we can reduce serum bile acids and control pruritus, then potentially we could increase survival of the native liver over time. We also have some longer-term data now on improvements in heights and weight Z-scores in this complex patient population. And this is data with adavixabat for 96 weeks of treatment. We have also seen similar efficacy in a recently published study, March PFIC study, that focuses on maralixibat. So we know that in both, and they had a cohorts of just BSAP patients and then all PFIC patients. So in both BSAP and all PFIC cohorts, there were improvements in pruritus severity, as well as reductions in serum bile acid concentrations that were seen very early on by week 2 and basically maintained throughout the study. There was also a greater pruritus and serum bile acid response rates in maralixibat group versus placebo group, again in both BSAP cohort and all PFIC cohorts. So this data is very strong and consistent.